Hi, this is Heather.
Hi, Heather. This is Channing calling from Ringfile Dermatology. How are you doing today?
I'm doing well. How are you?
I'm doing well. Thank you for asking. So I had in here that you wanted to talk a little bit about miraDry. Is now still an okay time for you?
Yes, now it's perfect.
Okay, great. Well, first off, let me hear a little bit, is this something you've been looking into for a while, or what all do you know about miraDry?
Yeah, I've been looking into it for a while. I've kind of just run out of options. It seems like it's pretty similar to what a lot of other people have just said online and just like what I've read in forums. I've really tried most different things, just like topical, antiperspirants and stuff. I haven't done Botox, but it just doesn't seem sustainable to me. So it's like,
right.
Yeah. So I've been kind of looking just towards this, and at this point, I'm going to get it. I'm pretty serious about it.
Mm-hmm.
But I just been trying to learn a little bit more and, figure out.
Right. And I'm just, correct me if I'm wrong, but I'm just assuming, is this something that you've dealt with, since teen years?
Yeah.
Okay.
Yeah, definitely. Since middle school.
Since middle school. And also other members of your family, have they been in the same situation?
Surprisingly, no, they haven't. So I don't really know where the genetics went.
You were just blessed. You were the lucky one.
Yeah.
Okay.
I was.
Yeah, very, very lucky indeed. Well, what's so wonderful about miraDry? It really is just such a it's a life-changing procedure that is able to get you out of this issue with excessive underarm sweating. It uses electromagnetic energy that is able to go in, targets the sweat glands, and destroys them. And the sweat glands under your arms only account for 2% of your body's entire sweat glands. So it's not changing, your body chemistry at all. It's only for your underarms. So it just is able to give you, the freedom finally to wear the things that you want to wear and not be consumed or worried about being uncomfortable. Somebody like yourself that already has a history and knows, that you're suffering from it, I would want you to, going into it, to not think that this is like a one-and-done type treatment. This 84% reduction in underarm sweating, that's obviously subjective, but that really is after 2 treatments, and it's priced accordingly. So the first treatment is $1,800, the second treatment would be $900, the third treatment would be $500, and you wouldn't even make a decision on whether or not you were wanting subsequent treatments until after 3 months. And you could wait several years. That's not going to mess with the efficacy of the procedure. But at that 3rd month, that's your new baseline. So you're not going to continue to improve from there. You're not going to go backwards from there. But that will be, and you're still fluctuating a lot, especially within that 1st month. People, report they can go through a period for about the first 2 weeks of almost excessive overdryness, which I know can sound lovely theoretically, but it can also be a little irritating. And that's just, once again, it's your body regulating itself. You'll start to sweat again. Don't be concerned that means it didn't work on you. It's just your body getting itself back to, where it needs to go. The procedure itself is very straightforward. We use, for the anesthesia here, we do a tumescent anesthesia, and what that means is that we're using a lidocaine and epinephrine in a saline solution. Before, they were having to go in, and it would be almost like all these little pricks up and down your entire underarm region, which is fine. It got you numb. It was able, it accomplished what it set out to do. But using this other type of anesthesia, we're really able to go in there and, for lack of a better term, almost like grapefruits. You're going to appreciate a fullness under your arms the size of a grapefruit. But it's going to further isolate the nerves. It's going to, just help with any type of adverse side effects, in the next few days. It's just better. The least interruption we have to make in the skin, the better. So how the physician assistant is the one that administers the anesthesia, and if you would picture your underarm like the face of a clock, 12, 3, 6, and 9, that's where she's going to first do the little pricks, and that's going to be the lidocaine. You will feel a little pinch and a burn. She waits for that to be numb, and then she uses those same insertion points to go in and fill up your underarm with the lidocaine, epinephrine, and saline. The epinephrine is there almost to constrict, well, it's there to constrict the blood vessels. The lidocaine is there for the numbing. And then you think you have grapefruit, but you feel nothing. Some people report down to their fingertips that they're still numb. Others maybe just under their arms, but it typically takes about 2 hours for you to metabolize that type of anesthesia, and so you still are able to drive yourself home afterwards.
Okay, perfect.
And then once you're numb, and we do recommend, I mean, obviously needles are involved. Just don't look at it. Look the other way.
Yeah.
But needles have to be used, but it's not anything that you need to stare at while it's going on. That tends to take about 45 minutes. Then you're nice and numb, and then I would do the procedure, and that takes around an hour. So all in all, you're probably in the office for a little over 2 hours. And you're not going to feel anything during the procedure. You're numb, you're good to go. I have several people, that have slept throughout the entire procedure. So it's pretty wonderful. Yeah, and then main thing, the first couple of days after, we really ask that if you can, take the time to ice as much as you can in your underarms for the first 48 hours. That's just going to help you with the soreness and the swelling. You're going to be sore under your arms. You're going to have swelling. You're still going to have numbness in the underarms for the first several days. That can last several weeks, and it can even extend a little bit beyond that. But it's going to dissipate with each passing day. You can notice, maybe it starts out that it was swollen, then week 2 or week 3, maybe it's just a little lumpy in areas. Maybe you have a little bit of isolated numbness under your arms. And we see that most of the time, even though we anticipate that to go away shortly after the procedure, it can last, several weeks to a month. And you're just, you can go back to your normal activities. We ask that you don't do any heavy lifting within the first few days, but you can continue about your normal routine. You just want to lay off the heavy lifting. You don't want to be shaving under the area until where the little pricks were have healed up.
Hello?
Uh-huh. I'm sorry, did we cut out?
Hi, sorry. Yes, I think just for a second.
Oh, okay. So any questions so far?
No, sorry. So you were saying no heavy lifting, no shaving.
Right, just for the first few days, because the heavy lifting, because you just had a procedure under there and you want to take care of it. The shaving, because with having the little pricks, even though they're little, still is an opening in the skin, and we certainly don't want to be introducing, bacteria. And once those heal up, you're good to go. But the nice thing, or a little side effect of miraDry is it does destroy up to around 65% of your underarm hair. So that part's also going to be
fantastic.
Yeah, isn't that a nice thing? I like that little added
Yeah, that's nice.
Yeah, and then the 84% reduction that people report, that does not mean that the procedures are linear. That you get half of that. You only get 42% the first treatment and 42% the second. It varies from each individual, but that average of 84 is after 2 treatments.
Okay, perfect. And then in terms of actual deodorant usage afterwards, should I also wait? Would I also be waiting to apply?
Yes, and I would,
a couple of days.
Right, and I would definitely, want you to throw away the current deodorant that you have because you're not wanting to reintroduce old bacteria. And as a good reminder of that, we always give you a trial size sample of antiperspirant. But either way, you're not going to be using that for the first 3 to 5 days because, once again, we really want those little pricks to heal up so that we're not irritating them anymore. And once they're healed, then they're good to go.
Okay. Okay, great. That is fantastic.
Good. So any other questions you have? Would you want me to look at scheduling an appointment? What's best for you?
Well, I am just curious, and I don't want to make any commitments right now, but what kind of availability do you have to perform this procedure?
We have, right now, we are several weeks out. However, I know that we're going to be able to start accommodating a little bit more, some procedures on Fridays. So I would think within the next 2 to 3 weeks, we would be able to get you in. It is a very popular procedure, and we only do the procedure Tuesday through Friday, and only out of our Haverford location. Unfortunately, we do not we don't do the procedure on the weekends, and we don't have this downtown. And then when you do, when and if you do decide to make an appointment, we would just ask you to put down a $500 deposit because we are saving 2 individuals there for the appointment. It requires, the physician assistant and a medical esthetician, but that would be applied to the procedure itself. And as long as you cancel within 24 hours of the appointment, or if you need to reschedule, that is refundable.
Okay, perfect. And so how does it, in terms of payment, is the full payment then due the day of?
Yes. Yeah, the full payment would be due the day of. And I don't know if you were looking, we don't have financing per se, but if you've ever heard of Care Credit, have you heard of that before?
No, but I don't think I would be doing like a financing.
Okay, but yeah, so it'd be $500 to book the appointment, and then you would repay the remainder, $1,300 after the procedure, and you wouldn't even, mess with, hey, am I going to need another procedure until after 3 months, and you wouldn't pay for that until at that time either.
Okay, got it. Okay, perfect. That is, and just to clarify, I know that I'm pretty sure this doesn't go through insurance at all.
Oh, no, wouldn't that be nice? Unfortunately, it doesn't.
I'm sorry.
Okay. Yeah. Real quick, because I just want to have a little bit more information for you for our records. Do you have, because you would never want to do this, first off, if you're pregnant. Second, if you have any allergies to lidocaine or epinephrine, have you ever had, like, dental work or anything where they've utilized that?
I probably have. I mean, I've had my wisdom teeth removed.
Okay.
So I don't know. I don't have any allergies to that off the top of my head.
Okay.
Yeah.
And then you would just want to make certain that in your underarm area you don't have any scars or skin tags or raised moles, because with going in there.
Oh, I do.
Okay.
That's the only. That I do.
Okay.
I have moles.
Okay. Well, have you had a skin check recently at all with a dermatologist?
I haven't.
Okay. So then the best thing, I don't know if you're close to either one of our offices, but being that this is a dermatology practice, you would be, I would definitely want you to make an appointment, if not here, with another physician to have a mole check, because you'd always want to have those areas checked out before you ever do anything to the area. Okay.
Okay, so and that I could just do like at the Center City location.
Yeah, and insurance, depending upon the type of insurance, if we accept it and all that, but that would, that's considered, that's a medical visit for a skin check. So they would be able to, that's a much easier one to book than the miraDry.
Okay, and so they don't need to be removed prior to the procedure?
Only if they are raised, and whatever physician you made the appointment with, she would know if they felt that there was a need to have them removed, and if there is, they would be removed, and then we would just wait until that mole, the removal of that area has healed.
Okay.
But it's mainly like you're just wanting not to have any deviation in the skin because of how the handpiece that we're using, the miraDry, it needs to have like a clean, clear suction. So that's why if there is a raised mole, it's not able to have that smooth surface, if that makes sense.
Yeah. Okay. Yeah. So I probably will have to get them removed then, because they're both raised.
Okay. And I always, it's always good to have a skin check.
Yeah, that too.
Yeah. Would you want, I could transfer you over to the front desk, and they could schedule you an appointment with a dermatologist if you'd want to set that up now, or if you just want to call back.
I'm gonna call back. I think I just wanna, I'm gonna just try to figure this out, because I was actually referred by my dermatologist at Thomas Jefferson to you guys for this, so I'll probably just go to her.
Oh, perfect. Yep, absolutely. That would be great. What was the doctor that referred you here?
Dr. Yang.
Yang, okay. Yeah, that's great.
Yeah.
That's perfect. I just want to put that in there. It's always nice to let Dr. Ringfeld.
Sherry Yang.
Okay. All right. Well, any other questions you can think about?
No, that's it. But thank you so much for mentioning that about the moles. I really didn't know.
No problem. And then, like, if this is something you decide to do, I would also, I'll send you kind of like a post-procedure checklist just to kind of remind you of, oh, so I should wear a tank top to the procedure. I should, shave 3 days prior, all the little things, freezing water bottles. That helps, but, we can cross that bridge when we come to it.
Okay, perfect. Phenomenal.
All right. Well, it's great talking to you, Heather, and just give us a call whenever, if you have any other questions or if you want to set anything up, okay?
Okay, thank you so
much.
I really appreciate it.
No problem. Have a great day.
You too.
Okay,
Bye.
bye-bye.